And thanks to tremendous effort and sacrifice by all Albertans, the outbreak peaked in late April, well below our modeling projections and hospitalization capacity, and it has been trending downwards ever since. Alberta started lifting health restrictions on May the 1st, and now we're more than 2 months into our relaunch plan. From the beginning, we kept more of our economy operating than many other jurisdictions in Canada and around the world, and we started reopening more and sooner than most. It's a tribute to the effectiveness of our health system and Albertans' strong sense of personal and civic responsibility that we did so well containing the virus under the least restrictive public health orders in Canada. Key to our success was the highest per capita testing rates of any province and among the highest in the world. It's the biggest and best testing system in Canada, and for weeks now, testing has been available to any Albertan, whether or not they have symptoms. In combination with our contact tracing app, Canada's first and for 2 months our only tracing app across the country, we have the best early warning system in the country, which allows us to jump on outbreaks and move quickly to stamp them out. We also moved early and effectively to secure our airports and borders against imported infections coming from international travel. And we learned quickly how to protect people in institutional settings after the early outbreaks at seniors' care facilities and packing plants. Of course, every one of the 161 lives lost so far has been a tragedy for their families, their friends, and for our whole province. But perhaps the best measure of our success in managing the pandemic is that Alberta's rate of 37 deaths per million remains far below the national average of 233. Even in long-term care facilities, which have accounted for 3/4 of all COVID deaths in Alberta, we have fared much better than Canada as a whole, with a fatality rate of 23 million compared to, 1 per 23 million compared to 143 million in the rest of the country. To keep our numbers low and keep all of us safe as possible, I implore Albertans to remain vigilant and disciplined. We saw large crowds gathering this weekend at Sylvan Lake, and understandably with the nice weather, but people very close together. I've seen that myself in parks and have seen people in crowded areas, including grocery stores, not wearing masks. And that kind of conduct, unfortunately, could jeopardize the progress that we have made. We are not done with COVID, but we are learning how to live with it. And our future success depends entirely on not letting our guard down. We need only look south of the border to see how bad things could be. Thankfully, New York and some other states that were hard hit early on have managed to turn the corner on infections, hospitalizations, and fatalities. But the virus has taken off in many other states, and the overall American numbers are amongst the worst in the world, certainly much higher than Alberta's. Yesterday, Florida reported over 15,000 new cases in a single day, and many states like Arizona, Florida, Mississippi are facing potential shortages of ICU beds in the days ahead. That's the worst-case scenario, and we have to avoid it here in Alberta. The reasons behind this are clear. Not enough care was taken to maintain physical distancing, to embrace widespread testing, and to follow the other basic protocols that we've put in place here. So I urge our American cousins to look north and learn from our successes. Many of us have friends and family in U.S. hotspots, and we're worried about them. But another major worry for us is the North American economy. Of course, the U.S. is by far our largest trading partner in the world, but both of our economies have been hammered by COVID-19, and both of our recoveries depend on getting business humming again and getting people back to work, neither of which can happen in places suffering large outbreaks. Overall, the current state of pandemic in Alberta can be characterized as stable. As of yesterday, we have recorded a total of 8,826 cases since it began. Of those, 7,989 have recovered, and there are currently 676 known active cases within Alberta's population of 4.4 million. Last week, we reached a milestone of 500,000 tests, and we're currently averaging about 7,000 tests per day during stage 2, although I understand we did as many as, I think, 10,000 on Saturday, which would be a record. Testing remains a cornerstone of our relaunch plan, and we continue expanding testing capacity. This includes piloting asymptomatic testing at pharmacies across Alberta and investing in targeted serology testing to get more data on how widespread the infection has been, including among people who never knew that they had it. From the start, we have been equally focused on protecting both lives and livelihoods, recognizing that the medical risks of COVID-19 must be balanced against the social, economic, and mental health risks of disrupting every other aspect of our lives. Risk assessment and risk management is built into our relaunch plan, with public health triggers designed to guide Alberta's actions through the stages of relaunch. The first trigger is change in the number of hospitalizations. During stage 2 of relaunch, the change in hospitalizations needs to be stable or declining and under 5% for 2 consecutive weeks for us to move to the next stage. I'm happy to report today that hospitalizations have been trending downwards from the start of relaunch over 2 months ago, and in fact decreased by another 0.5 percentage point over the past couple of weeks. There are currently just 45 COVID patients in hospital in Alberta, which is less than half the peak of 111 back at the end of April. The second trigger is the percentage of COVID-19 ICU beds that are occupied. During stage 2 of relaunch, less than half of ICU beds dedicated to COVID-19 can be occupied. Well, today, there are just 10 cases in ICU, far down from the peak of 23 back on the 1st of May. And we're sitting at about 20% of capacity. Not unexpectedly, we have seen a rise, less than 20%, in the number of active cases in the province over the past couple of weeks. This was perhaps somewhat inevitable as we reopened many activities and reduced restrictions on how people can interact. It's also no surprise that the demographics of infection have changed with a higher ratio of younger people testing positive for COVID-19. 55% of our current active cases are under the age of 40, and we are seeing a particular increase in those between the ages of 20 and 39. The flip side of this is that fewer older people are getting infected in relative terms, and it's seniors, of course, particularly those with underlying health problems, who are most at risk of serious illness and death from this disease. The average age of Albertans who have died from COVID continues to be 83. So what the data may be saying is that younger Albertans have taken to heart their civic duty to protect our elders, and whatever risks they are taking to get back to work, to play, and to live more or less normal lives, they're taking prudent precautions around those who are most at risk. But we can't take that for granted. To further help everyone do their part to manage the pandemic, we've created an interactive online map and an email notification system so that all of us can track the number of active cases in our communities. Currently, there are no regions subject to this enhanced classification, under which enhanced public health measures could be imposed to reduce risks. All regions are currently classed as open, but for 3 which are on the watch list because there are at least 10 active cases and more than 50 active cases per 100,000 in those regions. You can see those on the map here. Dr. Hinshaw and Alberta Health Services are working closely with partners in these areas to monitor the virus. The current outbreak at the MISERICORDIA Hospital in Edmonton is concerning as Alberta's first significant outbreak in an acute care setting, of which there are more than 100 such facilities across Alberta. As they've done successfully during previous outbreaks in continuing care facilities, health officials are working hard to contain the spread and to protect patients, staff, and physicians and other healthcare workers. Widespread testing is underway. Outbreak protocols are in place, and all patients in the hospital continue to receive the care that they need. I have complete confidence in the hospital infection control team and our public health clinicians to respond effectively, and I remind Albertans that we have a tremendous record on infection control in acute care over the first 4 months of the pandemic. And we are constantly learning and getting better at managing this disease wherever it crops up. So while relaunch is well underway, our public health response remains strong. Public health officials continue to test broadly and respond swiftly anytime a new case is detected. Dr. Hinshaw and her colleagues are watching every new case and outbreak closely and constantly assessing the risk to Albertans. We are prepared in the event that a second wave does arrive. This spring, Alberta Health Services freed up beds rapidly to ensure we had capacity to address a potential surge in new cases. So we've done the drill, and our health system is ready and able quickly to expand COVID-19 capacity if we see a surge in cases later this summer or in the fall. We all have a role to play in this fight. We all have a personal responsibility as Albertans, parents, friends, and neighbors to do the right thing and to follow the public health guidance. Masking is a crucial part of this guidance. Wearing a non-medical mask when it's difficult to maintain physical distancing is one way that we can all continue to limit the spread of COVID-19. I've been asked many times if Alberta will make masks mandatory. To quote Dr. Hinshaw, we can't enforce our way out of the pandemic, and the vast majority of Albertans, I don't think, need to be told to do the right thing. But we all know by now that it's our civic duty to reduce our risk of exposure and transmission as much as possible. And that means wearing a mask in crowded indoor public spaces where physical distancing is not possible. To make that as easy as possible for everyone, I'm pleased to announce today that Alberta's government is providing another 20 million protective masks for free distribution, once again with the support of private sector partners. We are the only jurisdiction in Canada to undertake a province-wide distribution of free non-medical masks. Throughout the pandemic, Albertans have responsibly managed risk and made personal sacrifices to help control the spread and keep themselves and others safe. Although research labs around the world are racing to find treatments and vaccines, and encouraging results are already showing up in some patient data, we're going to be living with COVID-19 for many months to come. The economic and social costs of a return to blanket restrictions would be deep and painful. And so we urgently need to get our people and our economy working again. So I implore Albertans to keep doing your part to contain the virus so we can all keep moving forward through the relaunch strategy and accelerate implementation of our recovery plan. Thank you.